Very good afternoon to everyone. While we have more people starting to join the room for our seminar series today, I just want to take some time to thank you all for joining us and also to introduce our speakers for today, Ms. Portia Poe and Ms. Ingrid Daniels. This is our third seminar session that we are hosting themed around mental health. And if you missed the first two and would like to recap the recording, it is available on our Singing Health Duke-NUS Global Health Institute's YouTube channel. My name is Natasha, and I am joined here by my colleague Glenn. We are both education associates at the SDGHI. And I would just like to go over some quick housekeeping before we start. Now you should be able to see some Q&A box on your Zoom bars. Please use that to let us know if you have any questions for our speakers today. And we'll have some time at the end of the session to try and answer as many of your questions as possible. Today's webinar is titled Mental Health Promotion and Advocacy. And we have the distinct pleasure of having two speakers who will be sharing about their work with us today. First, we have Ms. Portia Poe, who is the co-founder and executive director of Silver Ribbon Singapore, an organization that works to combat mental health stigma and promote mental health literacy here in Singapore. She is joined by Dr. Ingrid Daniels, who is the Chief Executive Officer of Cape Mental Health, which is the oldest community-based mental health nonprofit organization in South Africa. Both Ms. Portia Poe and Dr. Ingrid Daniels have served with the World Federation for Mental Health, and are both currently involved with the Global Alliance of Mental Health Advocates, an initiative that launched right here in Singapore in 2018. It launched at the first Global Summit for Mental Health Advocates. The Alliance hopes to serve as a platform to connect mental health stakeholders from around the world to share best practices, knowledge, and resources to advance the mental health promotion and advocacy agenda globally. With that, I'd like to hand it over to Ms. Portia Poe and Dr. Ingrid Daniels.
Thank you, Natasha, and Glenn as well, behind the scene. And everyone, good afternoon. And I hope you're taking your lunch or you'll be taking after this. And thank you so much for joining us this afternoon. And as what we have informed Glenn and Natasha, it will be in the form of a dialogue session when I have with me this amazing lady from South Africa, Ingrid, Dr. Ingrid, and she woke up especially early in the morning. Ingrid, what time is that over at your end?
Good afternoon to all the participants, and thank you so much to the Global Health Institute and Silver Ribbon for inviting me. So it's 7 a.m. in the morning, and I got up very early to be here, but I'm passionate about mental health specifically. So I got up very early to be with you, and I know it's your lunch break probably, but wonderful to be here. Thank you for the invitation.
Thank you so much. I always love talking to you about mental health. And I'm sorry, all the participants, this is going to end at 5 p.m. Yeah. So a brief introduction of Silver Ribbon. That is the organization that I'm serving right now. That's a charity organization to combat mental health stigma. And we've been working very closely with the ministers, member of parliament, all the stakeholders in Singapore, whether hospitals and those who are in the private practice. And we see the need to work closely with everyone and anyone, locally or even overseas. And that's why you see Dr. Ingrid with us. And why? Because like, as what World Health Organization has always said, no health without mental health. And collaborative effort is always important. If we are here to serve the community, we must work closely together and putting aside all our differences. And when we talk about collaborations with local and overseas agencies, so I talk about like World Federation has been repeated by Natasha, and for both of us, Dr. Ingrid and myself, we are serving on World Federation for Mental Health, and in fact, Dr. Ingrid is the former or immediate past president of World Federation for Mental Health. and she'll never say no to all our invitation. And in fact, if you want to meet her in person, she'll be here with us in Singapore on the 9th and 10th of October at our Global Summit. Look out for her, okay? This amazing lady. And on top of that, I also harassed her to join our Global Mental Health Project, which was launched in 2018 as shared by Natasha. And it was launched by our president, Madam Halima Yacob in Singapore in 2018. So you can learn more about that, and I shall not take too much of your time, and we move on to the dialogue session. So it's not so much as in presenting slides and sharing whatever we know. There's going to be a dialogue session between me and Dr. Ingrid, and thereafter, there's 40 minutes of dialogue sessions. Natasha will take over to handle the Q&A session. So now, thank you, Ingrid, for waiting. And I have a whole list of 100 questions for you this morning. Yeah. And to begin with, you have been serving on the board of World Federation for Mental Health all these years. And what are your views on mental health as a representative of World Federation? For example, what is the current situation, the gaps, and the limitation? To you, Ingrid.
Thank you so much, Posh, for the asking me this question. And I want to start off by saying that mental health is everyone's business. And without mental health, none of us are able to function optimally. And so the World Federation for Mental Health and myself and many of the mental health advocates have been very concerned about the current status of mental ill health across the globe at the moment. The world is still reeling from the, and I'm not going to say post-COVID because we're still in a very COVID-19 pandemic. It might not be a pandemic any longer, but just recently, we have very good genomic studies in South Africa. They found a new variant, which again is highly infectious, and we know the impact that COVID-19 has had on the mental health of everyone. The one thing about the COVID-19 pandemic, it left no one unscathed. We were all affected in some way or the other. And so with that as backdrop, we see a number of negative impacting factors on people's mental health globally, such as I said, coming through 3 years of the pandemic and its impact on individuals, on economies, on the way we live, the way we had to readjust and function. Poverty. I live in South Africa, and I live on the continent, obviously, of Africa. And the issues around poverty and the social determinants that impact on individuals' mental health is enormous, huge concern for us. Secondly, wars. We know about the current wars being fought on the very continent of Africa, but also in Europe. The war between Ukraine and Russia, and many others. And then the threats of war. Displacement, people are displaced. We hear every now and again, we see on our world televisions, we see refugees crossing over, fleeing from their countries. We see the impact of climatic conditions on mental health and the consequences it has for well-being. So, we live in very trying times. We live in very challenging times. There is no normal. And so the burden is enormous across the world. And the World Health Organization in 2022 said that the global burden of disease estimated that just as a result of the COVID-19 pandemic, I'm not even talking about the impact of wars or the social determinants of mental health, but just taking the pandemic, we saw that the pandemic itself led to a 27.6% increase in cases in major depression disorders and 25.6% increase in anxiety disorders worldwide. So again, as I said, no one was left unscathed. And so if you're looking at what does the situation look like worldwide, just in terms of prevalence, a number of people living with anxiety and depression has increased exponentially. This is in 2016. These were the facts and findings by the World Health Organization. And then compounded with the issues I've just raised, we are very concerned that close to 1 billion people worldwide live with a mental health disorder. Very concerning. 1 in every 4 persons have a mental health condition, while 13% of the global burden of disease has been caused by mental ill health. So very concerning, obviously, that we sit in the situation where we see this increase in prevalence, we see enormous impact on lives, and mental health in particular, or mental ill health in particular. So sadly, we are seeing this increase in mental health disorders worldwide. And you may have seen a similar trend in your own country. So really concerning. But added to this concern is the fact that suicide rates have increased. Sadly, our young people, 15 to 29 years old, it's been found that the 4th lead cause of death in that population is suicide. So we are talking about mental health conditions that have consequences for life. And hence, the increase in prevalence should be taken seriously. And you know, a further concern we have is the huge gaps in treatment. Even in high-income countries, it's been found that 50% of persons with a mental health condition living in high-income countries, I'm not talking South Africa, I'm talking high-income countries, have no access to mental health care. Ladies and gentlemen, there's a concern, but the concern rises when we start looking at middle and low-income countries, because now we see an even bigger problem, because up to 85% of persons with a mental health condition, 85% living in low-middle-income countries have no access to mental health care. On the continent of Africa, Sierra Leone has up to 98.8% who have no access. Here's a serious problem, an absolutely serious problem. And the World Health Organization has sadly said in its survey, it found that on average, governments in low-middle-income countries, high-income countries spend about, on average, 2% of their budgets on mental health, 2%. Then again, if you take yourself down into the low middle income countries, the more countries where there's higher rates of poverty, this percentage of investment is even less, 1%. So when you look at the prevalence and you look at the very low investment, despite the call for greater investment in mental health globally, and we have done that as the World Federation for Mental Health, we've called for greater investment. And during those campaigns, we get a lot of, agreements on it, and it's wonderful. But those agreements seldom translate into reality for increased access and scalability in mental health. The sad other impact is that from an economics perspective, a world impact on loss of productivity, we have another problem. The Lancet in 2020 stated that the loss of productivity as a result of the 2 most common mental disorders, depression and anxiety, will cost the global economy, and listen to this, $1 trillion every year, not in 10 years, every year. Again, I raise the alarm bells, because there is clearly worldwide a very serious problem. I mean, even Dr. Tedros Ghebreyesus, the Director General at the United Nations said that good mental health and well-being are essential for all of us to lead fulfilling lives, to be able to make a contribution to our families, to our communities, to our country, and to be able to participate productively. And we know from research that for every $1 invested in individuals, you get a $4 return on that investment, in increased productivity, in people being happier, having better mental health. So if I had to just have an economic case, there's a case for greater investment. But sadly, that disjuncture between prevalence, increasing prevalence, and lack of investment is the crisis, in fact.
Yeah. Thank you, Ingrid. Thank you for sharing so much. I mean, like, I was recording notes as well, you know, about the prevalence and the suicide rate and the amount of budget being invested in mental health promotion and advocacy. And you talk about the $1 trillion, you know, spending $1 trillion every year. It's not like, wow, this is disturbing. But the thing is, like, that's why, especially when we are talking to our audience right now, who are mainly clinicians or, you know, those people who are working in the healthcare sector, they are equally important to join us to raise the awareness. And collaborative effort is definitely very important so that you can help to fill out the gaps, so that we can encourage more people to come forward to seek help. Wouldn't you agree, Ingrid?
Absolutely, absolutely. And this is why mental health awareness and promotion is so important. Because often people fail to talk about their mental health. They rather suffer in silence, and really suffer in silence, than come forward and say, I'm struggling. I'm struggling with whatever symptoms they have. And remember, there's always a predisposing factor. There's always a reason as to why people have a mental health condition. And so we want to encourage that conversations change. Often people are reluctant, particularly young people, to come out and talk about the mental health challenges that they are experiencing. And that's very worrying, because we know, and this applies to other medical conditions as well, is that the earlier you can intervene, the better the mental health outcomes, the better health outcomes you will have. And so, tandem to raising awareness about mental health, but not only mental health globally or country or locally specific, but your own mental health. Coming out and talking about your mental health is of critical importance. There are wonderful interventions. There are wonderful organizations. I think of your own, Porsche, Silver Ribbon, and the amazing work you do in Singapore. There is help. And if you take away anything that I say today, is that mental health is everyone's business. And there can be no health without proper mental health. And if you are suffering, and if the patients you see are going through difficult times, refer them on. There are safety nets. We can do, and we want to give people hope, you know, recovery is possible. That's what I want to say as well, that recovery is possible. But the sooner we can intervene, the better the outcome, the better the prognosis, in fact. And when you listen to me saying that more than 1 billion people across the world are living with a mental health condition, it's everywhere. It's in our families. It's amongst us as we sit here today. You know, it's not something out there, but often stigma and misconceptions and discrimination prevent people from coming out. And so even here in South Africa, and I'm sure you've done very similar work, we try and get people to come and talk. And we call them mental health ambassadors. And in Cape Mental Health, the organization that I'm CEO of, we have a campaign where we get young people to come out. We get artists, we get musicians, we get professionals to come out and talk about mental health. Just last night, we had our annual general meeting here in South Africa. And our chairperson spoke up and she said, I live with a mental health condition. And she's a lawyer, she's an attorney, you know, so no one's immune. No one's immune. So let's change the conversations. And, this was the one positive thing about COVID-19. With all its negativity, everybody spoke about their mental health. You had a Zoom family meeting, because remember, during those dark days of isolation, the only option you had was possibly to Zoom in or to have a phone call. Everybody spoke. And as you were able to come out, from the sort of being isolated at home, people spoke about it at restaurants, over lunch, so why don't we continue that? Because the issues are still there, people are still living with challenges, particularly my heart is really concerned about our children and our young people. We want safety nets for them, because there are resilience enhancing interventions to help young people cope. And you're not alone. They are not alone. None of us are alone. But it's to take that first step. And that's what we need to encourage. Remove the stigma, take away the misconceptions. And this is why mental health promotion and awareness raising, I'm passionate about it, because we're dealing with early detection and then also early intervention. And hopefully we'll have better outcomes. And prevalence would reduce as well.
Ingrid, I always love you for your passion. I believe all the audience can feel your passion. So the thing is, like, there's a question being posted at the Q&A session. We leave it to 1:40, and then proceed with that to be facilitated by Natasha. So you have talked about the global scene, right? What's happening across the world, and let's come to South Africa, because I heard so much. And I was there once, and I heard about what you all were doing in South Africa to commemorate World Mental Health Day. And one very significant or signature World Mental Health Day event is flying the kite. Am I right? Would you want to share more? And what is the current situation in South Africa? Because recently I have heard about the power cut as well.
Yeah, so thank you very much for asking about South Africa. So I don't work for SA Tourism, but I can tell you it's a beautiful country. I live in Cape Town, and it's a peninsula, and I have the ocean and I have the mountains. It's really beautiful, but we have our challenges. We do have our challenges. And one of the challenges, big challenges we've been experiencing nationally is, so as we were coming out of the COVID-19 pandemic, so the pandemic might be over, as I said, but there's still COVID. But as we were trying to normalize our lives again, South Africa sadly found itself in a situation where it had too much demand, or normal demand, I should rather say, for electricity or power, but insufficient supply. So what the country then did to regulate this was to have regularized power outages. We call it load shedding. So we have apps. Wonderful, wonderful. You can look at your app and immediately 3 o'clock today, I'm having 2 hours of load shedding. Well, there's something to be said about that that's very concerning, because it's like deja vu. It's like a lot of the impacts are very similar to the impacts that COVID-19 had. It has sadly created a situation where there's increased anxiety, there's increased depression. A study was done by the South African Anxiety and Depression group, a small study. And from that, 6 out of 10 people that they interviewed said that they saw an increase in their anxiety as a result of load shedding, and about 45% indicating that they had more symptoms of depression. So with load shedding, the situation we find ourselves in is, because it's obviously dark in a specific area, people are very limited. We do have a problem with crime. We have a high crime rate in South Africa. So you can imagine, with load shedding, people are then reluctant to go out. People are more isolated. It has specific implications for children and adolescents living in poverty-stricken community. If you're wealthy or middle class, no problem. You know, South Africans are great inventors. So we adjust, we make a plan. So you have inverters and you have USBs and you have power globes, and you'll never say there's load shedding. However, where the majority of South Africans live are in the townships. And there's no money for inverters and globes, power globes. So children are literally sitting with their candles, I mean really candles, and trying to do their homework, trying to prepare for their university assignments in those conditions. And these are negative impacting factors. These are negative factors that impact on the mental health of a number of South Africans at the moment. So it's not a pretty picture. And the sad reality about that is that there is no proper contingency plan in place where we can actually say, in a year or in 24 months, this situation will be reversed and we will have power as it should be. So the lack of contingency plans and the lack of a clear end to this creates a lot of frustration as well. You can imagine it has an impact on health services. It has an impact on the economy. It has multiple impacts. And at the end of the day, already we have many social determinants of mental health, particularly poverty. And now you add this. Again, we're back to square one of this increase in prevalence. Already, mental illness and neurological conditions rank the third highest burden of disease in South Africa. And it's not reducing when you have these negative mental health impacting factors, which will obviously escalate prevalence. So highly concerning, and the fact that 93% of South Africans are dependent on public health, which is a very fragile public health system because everyone's dependent on it for every possible health condition. So very worrying, and the stats are very similar to those which I presented earlier around access to mental health services in South Africa. So about 85, depending on where you are, it could go up to 90% of South Africans have no access to mental health services. So for us as a mental health organization, that's a huge concern, because then I have to conclude that we are only touching the tip of the iceberg, and that's worrying. So there's this constant dialogue in my head about how do we get to scale up against this context of extreme poverty in the background. How do we scale up, you know? And we do. We have some, and we can talk about that a bit later, but very concerning. And also, again, our children and our adolescents, about 17% of children, children and adolescents in South Africa have a mental health condition. But globally, it's about 20% of children and adults, children and adolescents have a mental health condition. So very concerning, because we know that 50% of mental health conditions in adulthood originated in childhood. So very concerning. But so what do we do? And you asked me the question about this awareness event, this mental health promotion event, which is the Kite Festival. So we want people to talk about their mental health. We want to create the safety nets. We want to say to them, you're not alone. There are treatment options, there are solutions, recovery is possible. And so we have this massive Kite Festival. It's the largest international kite festival on the continent of Africa. And I'm not talking about tiny little kites. I'm talking massive kites. So you can have Tweety birds in the sky. You can have sharks in the sky. You can have scuba divers. So all these characters, Disney characters, are flying. And we have a wonderful partnership with international and local kiters who come. And these people are amazing. And I call them our mental health advocates. They're the ambassadors. They come with their kites, large kites. They come and they carry the costs of, their flights, bringing these large kites, and we fly kites with messages. So last year, our theme was, hashtag fly your dreams. This year, we're wanting to give people the opportunity to have a canvas. And this year's theme will be hashtag the sky is your canvas. There's no limits. And the wonderful message about kiting is, kites soar against adverse winds. So no matter what people go through, no matter what the challenges are, you can soar despite what happens. And so kiting, the symbolism of kiting is absolutely amazing. And we have amazing awareness, and we use every possible medium that we can to get the message out. And the past year, we had over 5.5 million South African rands worth of media exposure, raising awareness. So absolutely amazing. And every October, which is for us Mental Health Awareness Month, but then as you know, Mental Health Awareness Day is the 10th of October, medias, the radio stations are contacting us. Everyone wants to speak about, and it's wonderful, and the crowds just come out. So October is our summer, our spring. We're still in spring, but it's beautiful. The weather's good. And because of COVID, obviously we couldn't have these. We normally have about 25,000, between 21 and 25,000 people at a good open event over 2 days. But with COVID, obviously, we had to re-strategize. And so we had what we called pop-up kite fly. So these kiters would go down to the beach, we'd tell everybody, and being outside was a better option for everyone. They could still physically distance. And we would have the ocean as the backdrop and the sky decorated with these beautiful, beautiful kites. And the thing about kite flying, you've got to look up. You've got to look up when you fly kites. So yeah, so that is really our showcase event in South Africa, and specifically run by Cape Mental Health. And again, kiting as a symbolism. So we want the children in the townships and the communities to also experience. Some kids have never even seen a kite. They don't possess a kite. So we have, over that basically a week, the entire month, we do a lot of activations. But one of the things we do, which I find wonderful, is we go into the community and we get children from the local schools, mainstream schools, and our special education centers for children with severe and profound intellectual disabilities to come together on a sports field. And these kiters come, and there's media, and there's, journalists, they all come. And the kids integrate. Children from mainstream schools and children with severe intellectual disabilities. And there's something else that happens in that space. Suddenly we're talking inclusion. Suddenly we're removing, this distance that often exists between kids at mainstream schools and kids with disabilities. And the kids love it. They run after the kites. It's a fun morning for them. And one grandmother said to me at one of these community flies, we call it, she says, she said it in Afrikaans, but I'll say it in English. She said, "Madam, my grandchild has never seen a kite. And today you've brought color into our community and my child's life." So yeah, wonderful, wonderful event to just talk about mental health and to get the message out that mental health is important. And we want to give back hope. We want people to know that they are resilient.
Thank you, Ingrid. Wow, so much about South Africa. Such a simple and such a profound message, bringing colors into their life. And that's very important. And to raise awareness. And also in Singapore, due to the extent of mental health stigma, we have to be very careful when we raise awareness when it comes to mental health. It's a taboo. Yeah. And in view of all the challenges that you have shared, in your opinion, with the remaining 5 minutes, what could be done to improve the current situation, to address the gaps and everything? What is your opinion on that?
Sure, thank you. So my opinion is that, first of all, as we know, I've raised the facts as to what the situation looks like worldwide. But we have to start firstly by acknowledging that there is a crisis. And we need political will, but we need all of us, every one of us, to put mental health, to put the spotlight on mental health and to give it the necessary priority that it deserves. I believe that there should be greater investment. And when you talk investment, often people think it's going to be a lot of money. There are wonderful, wonderful, innovative interventions which cost very little for people to be able to access free mental health. Very little cost. So the call for greater investment in mental health means that we can step in with early intervention programs, bring down the prevalence, but most of all, that we focus on multi-sectoral, multidisciplinary responses. Because mental health impacts on economies, on education, on everything. It's not secular. It doesn't only affect scholars or the economy. It's across every sector. And therefore, we do need a multi-sectoral response. We need countries to have legislation and policies around greater advocacy, around promotion interventions, but also specifically interventions as such to reduce this sort of increasing prevalence. You know, every time I present, the prevalence rates increase. Prevention of disorders is one of the most effective ways to reduce the burden and this burden of disease. So we do call for a multi-sectoral response to addressing mental health challenges. It's everyone's business. But I think often because mental health is, as you say, such a taboo issue, it's so stigmatized, people put their, like, I can use the analogy of an ostrich because I'm a South African, that ostriches, you know, they often put their heads in the sand, and often governments operate like that. So they put their heads in the sand and pretend there's no mental health challenges or a crisis. Well, there is a crisis. And so I think we need to stop ignoring the problem and dealing with the issues. But definitely, you know, mental health is everyone's business. And I want to just end with a quote from Vikram Patel, Professor Vikram Patel, and he said, "There is no health without mental health. Mental health," and listen to what he says, he's a psychiatrist, well-known psychiatrist, he says, "mental health is too important to be left to the professionals alone." So it's not a psychiatrist or mental health professional's problem. He says, mental health is everyone's business. So all of us in our various sectors in the health field have a responsibility. And that responsibility is to put that spotlight on the mental health of the people you render services to, but most of all, your own mental health.
Wow, short and sweet. Thank you so much, Ingrid, for sharing so much about mental health promotion. And Natasha, I guess you are around. We hand it back to you, Natasha.
Thank you so much. That was great to listen as both of you are talking. Glenn and I are really just texting each other saying, wow, we feel like we're listening to a podcast because both of you speak with such passion when it comes to the mental health agenda. And I'm really excited to be able to kind of just moderate this Q&A session and ask you both a little bit deeper and dig a little bit into kind of your perspectives. And just want to remind all the participants who are in the room right now, if you can just send in your questions into the Q&A, and my colleague Glenn will kind of filter through them and we'll answer as many of them as we can. So I actually really want to start with this question, which is actually a personal question for myself from listening. And this question is directed to Porsche. And I do want to ask, considering Ingrid's sharing about the kiting campaign with "The Sky is Your Canvas," I do want to ask Porsche, what would an equivalent to this kiting campaign look like within a Singaporean or even an Asian context? I would love to know.
Thank you for your question, Natasha. I mean, I was expecting that. What is being done in Singapore after our dear Ingrid has shared so much what is being done at her end. So I'm not sure whether everybody is aware that there's this Beyond the Label campaign in Singapore launched by the National Council of Social Service. So try to Google Beyond the Label, and there's this campaign, and they are also having Beyond the Label Festival on the 8th of September at Jewel, that's at our airport. So I do welcome everyone. I'm part of the work group as well under Beyond the Label campaign, where National Council of Social Service mobilize all the mental health agencies in Singapore. So this should be on par to the kite flying at South Africa. Thank you for your question.
Thanks so much, Porsche. Everybody, please mark your dates for 8th September, because there's been a massive call to action today, and I think if we don't show up, we're going to be in trouble. All right, so we did talk a lot about also how young people are involved and what adolescent mental health looks like. And we had a question from the floor about young people approaching mental health services and what that looks like in comparison to the older generation, and when the older generation tends to seek help for mental health services. Because here in Singapore, we have an aging population, and sometimes among the older generation, there's a lot more stigma, there's a lot more taboo. It's still very unconventional to talk about mental health among the older generation. So Porsche, do you think you could share a little bit on that perception, and also perhaps Ingrid, you could also share about what you think would be a suitable solution for within our context?
So thank you for your second question. I'll begin first, followed by Ingrid. So in my opinion, rather than different age group are facing or younger people are having lesser taboo according to this message, in my opinion, after observing the population or the community's needs, they have different groups or different issues or different type of concern. For older people, sometimes it's about the face value. I do not want to be seen or labeled with mental health issue. I'm not comfortable to speak up about having a loved one with mental health issue. This is what is happening. And then for younger people, there's also stigma about speaking out, and how people will judge them. And also, although I understand that the latest announcement was like the increase of school counselors, but how many students are comfortable to approach their school counselor on their concern? So most of the students or youngsters will say, I do not want to be seen speaking to a school counselor. So what are they doing at the end is that they are contacting the social service agency in the community, and they feel that it's less stigmatizing. So in my opinion, it's about creating a safe space for everyone, regardless of the age group or whatever, making them feel comfortable to speak out about their concern. So, whether it's like, regardless of the age group, people will still experience stigma in different ways. To you, Ingrid.
Thank you so much for the question. So yes, we found in South Africa, and not just in South Africa, it's probably across most traditional communities and societies. So we have various, South Africa is made up of various, if you want to call it tribes. So in the Western Cape where I live, we've got 9 provinces. It's the Xhosa population. And what we have found is that when people start presenting with mental health symptoms, the first contact is not with a mental health professional. It's actually with the traditional healers. So that for us is an indicator that we need to work alongside the traditional healers and do a lot of training and come together rather than against. And in that way, I think we're going to have better success. And that's really the older population. The younger, our youth are obviously they're more exposed to Western society and the way of Western life, but there is a reluctance to come out. So they'll talk about mental health because a lot of young people are talking more about mental health. And we saw this as well during the COVID, but seldom, or there's more reluctance, I should rather say, there's reluctance to come to the fore when they are actually symptomatic. So we have to find, and I think for us as mental health organizations, strategies that speak to young people. The traditional way of providing mental health services don't always work for young people. And we've got to stretch ourselves to look at interventions that are better suited to younger people. There's one organization in South Africa, it's called Waves, because we have the ocean. So surfboarding and is part of what they do. But in the surfboarding and the activities of this organization, they have a big mental health focus. And so young people are more, or are part of that sort of surfing community, are more open to wanting to speak out because there is a way to facilitate it that speaks to that population. So I'm using that as an example because I think we need to find ways and strategies to allow for young people to come out. I think the traditional ways of providing mental health services isn't doing it for young people because of stigma, because of, what will my friends say? And I understand it when we've got a mental health, it's called Youth Matters program at 5 schools. And these are schools in very dire communities. So we've had to think very carefully about how we do. So a lot of the work we do is around awareness raising, promotion. At the minute the learner comes to the fore and says, I need to talk to someone, we then refer them out to our social worker outside of the school environment, because there's always the fear that there'll be name calling, that they'll be labeled. And so therefore young people don't want to come out and talk because of, so you have to do these things in tandem or, together simultaneously. On the one hand, create awareness, but on the other hand, together, simultaneously almost provide the intervention when required. But for young people, I think we are not stretched enough, and I speak for myself as well, around what we could do that is more appropriate for young people. But young people speaking out and young people being involved, and we also find this with people with lived experience of a mental health condition. When they speak out about mental health, more young people will come out and speak about mental health.
I think I'd like to add on as well to Ingrid. Thank you so much, Ingrid. Once you talk about schools, it reminded me on something because we are working closely with SMU, Singapore Management University, to conduct this peer support program that is to equip the students with basic mental health knowledge so that they can provide support for their peers who are not ready to speak to a school counselor. So we do have this, and we have been collaborating with SMU for more than 10 years all this while. And on top of that, we also offer internship program for youth to know more about mental health. And another way of supporting students or to enhance mental health literacy will be involving them in school mental health projects. So each year we work with different school institutions on school mental health project so that they can improve their mental health literacy. And at the same time, who knows, maybe one fine day they might join the mental health industry. Thank you.
Thank you for both of your responses. Connecting to Ingrid's point, she talked briefly about lived experiences. I do want to touch on that a little bit and we also want to connect that with our previous session with Charlene Sunkel. She talked about integrating lived experiences in global mental health. And I want to ask the both of you, do you also observe a trend of experts by experience becoming more prominent within your organizations?
Yeah, absolutely. You can't provide mental health services and not have people with lived experience being employed. So we employ people with lived experience. So South Africa's employment equity, very low, says that 2% of persons employed need to have a disability, very broad. We have 14% of our people who work for us with a disability, of whom the majority are people with a lived experience. And we have also employed them as peer counselors, like you have a portion in your organization. It's far more powerful. You know, a lived experience is very different to a professional experience, unless you as a professional yourself have had a lived experience. They speak about the symptoms with sincerity, with a lived experience of what that symptom means for them, and also their strategies that they've used to cope with some of those symptoms. So absolutely, I mean, on our board, we have persons with lived experience representing themselves on the board. So in the disability movement, there's a concept and there's a saying, nothing about us without us. So it's you cannot talk about mental health and interventions without including persons with lived experience in every aspect. The same applies to the World Federation for Mental Health. The same applies to my organization, and I think Porsche the same with you at Silver Ribbon. I know Charlene very well. We've authored on on a few articles, but we've also worked together very closely. Years ago, she was the advocacy officer at the South African Federation for Mental Health, and the World Federation's Women's Mental Health section works very closely with the global peer network. And as we know, Charlene is the CEO of that organization. So even when the women are running webinars, raising awareness about women's mental health issues, we ensure that one of the presenters will be someone with a lived experience. Very important. I don't think you can talk about mental health or even talk about strategies. So things around policies, things around legislation must have the voice of persons with lived experience. It's non-negotiable.
Mm-hmm. Well, from my end is about like we talk about having peers to speak and share on their personal experience is very powerful. In fact, it's much more powerful, pardon me, all the psychiatrists who are tuning in, it's more powerful than mental health professional or practitioner because they've been through the journey. So it's more convincing if the peer support specialist, that's the term adopted in Singapore. So there's such thing as peer support specialists. And once again, this program is supported by National Council of Social Service as well. So when they recruit persons with mental health issue, and they will conduct a training to equip them with basic skills and everything, and they will tell the story on mental health and to raise awareness and to inspire others to move on with their life. And this is very powerful. When you have a psychiatrist advising a patient to take their medication, it's not too convincing because I'm the one taking medication, I'm the one experiencing side effect. So it's much more convincing if you get a peer support specialist to be involved. Thank you.
Thank you, Parsh. Thank you, Ingrid. Yes, we do have a big question here, which is actually linked to a previous question that we had from the registration about how to create psychological safety in the workplace. And what does that look like in terms of peer-to-peer support, but also from a systemic top-down approach from a managerial level, where in Singapore, there are many organizations that will have a mental health day, but not generally prioritize mental health. So I want to hear from the both of you kind of perhaps just your views on psychological safety in the workplace.
Okay.
Thank you so much. Very important. We have found that often work environments can be very toxic and trauma-inducing. And, if any business is concerned about their employees, it's important, I believe, that every business, every organization, whether you're an NGO, whether you're a corporate, whether you're in the medical field, whether it's in education, doesn't matter which sector, there should be mental health support programs for employees. But the environments in which people work is of even more importance. It's no point you have employment assistance programs, but the work environment is toxic. It can't work. It's like providing a band-aid for something you create, the scars you create. Sorry, it doesn't work that way. The entire work environment. So I believe there's got to be a lot more training and awareness raising amongst management within corporates, across sectors, to raise this very issue around mental health. And I touched on it earlier on when we were talking in the dialogue. If you want to reduce your absenteeism in the workplace and you want to increase your profits, the best thing you can do is take care of your staff members' mental health. Your return will be $4 compared to the losses that you are suffering. So I can go on about making an economic case for ensuring that mental health in the workplace becomes a priority. It's good business. Return on investment, what can I say? But it's your work environment that has to change, and that is a challenge that I put out to any corporate. Change your work environment, become a mental health friendly work environment. Added to that, also provide mental health support for your staff. And there are many ways to skin a cat, as they say. Please don't skin cats, but it's just a saying. So if you don't want to provide the EAP in your workplace, you can also outsource it to an organization outside of your workplace if you want to create more safety. But that should be a priority, absolutely.
Thank you, Ingrid. And I was preparing the whole list of answers to Jacqueline's question. So Jacqueline, thank you for your question. This is very close to my heart because we took more than 5 years to appeal to Ministry of Manpower to remove the mental health query from job application form. Because during the past, wherever Singaporeans need to apply for a job, there's a question: do you have mental illness in your job application form? And for years, Silver Ribbon, our team, has been appealing to remove that clause from the job application form. And indeed, the pandemic is a blessing in disguise, because in January 2020, TELFAC, under Ministry of Manpower, announced that they are advising the employer to remove the clause, to remove the mental health query from the job application form. This is the best news of all, besides decriminalization of suicide in Singapore in January 2020. And next will be, they announced about the EAP, Employment Assistance Program, or Employer Assistance Program, that is like in November 2020 as well, where a lot of employers, they do have an advisory on how they could support their staff at the workplace. And next, in fact, after this online dialogue, I'm going to leave for another discussion hosted by Workplace Safety Health Council. So I'm part of that under the mental health. And we are looking at the guidelines, for persons with mental health, or guidelines how to promote mental health at workplace as well. Let's keep our finger crossed, because we have representatives from all the sectors. Then next, how could we support people at the workplace? Our suggestion is to provide accommodation like time off, allow them to excuse themselves for their medical appointment or whatever, or to revise their job scope so that they can meet the criteria. and to equip the management and the supervisor with basic mental health knowledge so that they can support the staff at the end. And last but not least, I'm proud to say that Silver Ribbon actually launched the award ceremony for employers. And we have been starting that since 2020. And this year, Ingrid, you're going to witness that at the Global Summit, where we have invited the very kind Minister of State, Sun Xiaoling, and speakers, Mr. Xia Jinping, speakers of the parliament, to present the award to employers which has been actively promoting mental health at the workplace. Thank you so much for this question. Let's stay hopeful, okay, everyone?
Thank you so much. It is now 2 p.m., so I would like to thank the both of you so much for joining me today. And before the participants leave, I also want to put up this QR code if you give us feedback on the seminar and your thoughts on how the session went. We would greatly appreciate it. Once again, thank you so much, Parsh, and thank you so much, Dr. Daniels, for joining us today. Your sharing was very insightful, and I'm sure we'll look forward to seeing you again in the future. Thank you so much.
Thank you very much, and have a wonderful day and weekend too. Thank you.
Thank you, everyone. Thank you,
Bye.
Ingrid.
Bye, everyone.
Thank
Bye.
you. Bye-bye.